Did you know that over 70% of chefs suffer from mental health issues such as anxiety and depression? The kitchen is a high-pressure environment, with 69% of chefs reporting that their job is stressful. This constant stress can lead to serious mental health problems if not addressed. It's crucial to understand and address the stress levels chefs face every day. Let's work together to reduce stress in the kitchen. Share your thoughts and join the movement for healthier work environments for our chefs.
Hello everyone and welcome to my presentation HRM 552 on workplace stress and mental health challenges in the Malaysia culinary industry. In recent years, this issue has become more visible, especially with increasing public awareness about mental well-being. High-pressure environments like restaurant kitchens and hotels are facing urgent calls for reform. And as today, I will explore the causes, impacts, and solutions to these challenges that I will give to you with examples and evidence from Malaysia.
Working in the kitchen is one of the hardest jobs I've had in my life. You're under this constant stress, and on top of that, you're working long hours, you're on your feet all day, and it's just completely physically and mentally straining, and most people can't handle it. But I love it.
Workplace stress in Malaysia culinary sector has grown significantly over the past 2 and 3 years, exacerbated by the COVID-19 pandemic, which forced many restaurants and even hotels to close temporarily or permanently. When the operations resume, staff face increased pressure due to the staff shortages, longer shifts, and even heightened customer complaints. They even don't have time to spend with their family due to the time shortage. Hospitality workers have reported some of the highest rate of anxiety, depression, and even psychological distress compared to the other industry. Meanwhile, another study focusing on the kitchen staff in the Klang Valley revealed that the financial stress, general stress, and even depression significantly impact their mental health, with the depression being the most critical factor.
Many chefs work between 48 to 60 hours a week, often more than their contracted hours. Long working hours can lead to burnout, fatigue, and poor mental health. 51% of chefs report not having a good work-life balance. It's important to push for reasonable working hours and a better work-life balance for chefs. Support the cause for fair working hours, speak up, and advocate for balanced work-life for chefs. Your voice can make a difference.
In Malaysia, several unique causes of stress exist in the culinary fields. First of all is because long hours of work, especially during Ramadans or festive seasons, plus they have to cover others who emergency leave and medical leave. This will surely resulting in burnout. The second one is low wages. They have worked very good and very nice, yet they didn't get the amount they deserve. Why? Bonus also deducted, and some company don't even give bonus, and their overtime is not even paid. This is because of the inflations of the Malaysia that makes the currencies goes down. The third one is lack of benefits such as healthcare or paid time off. The high expectations from demanding customers and managers make them really burn out, and they cannot do the work and feeling the stress. Last but not least is toxic work culture, including verbal abuse and rigid hierarchies. Additionally, mental health is still a taboo subject in many kitchens, with workers discouraged from the showing vulnerability. In addition to the impact for individuals, stress leads to fatigue, poor sleeps, anxiety, depressions, and in some cases, suicidal ideations. 2023 studies found that the emotional exhaustion among hotel foods and beverage staff is significantly impacted by low pay and even the work overload. For employers, this means heightened rates and lower morals and difficulty to find the experienced staff. For the government, public health costs rise and the economic productivity will be shortly reduced. For the society, poor mental health in chefs affects the food's quality customer experience, and even the sustainability of Malaysia's rich culinary culture. Furthermore, if we ignore this problem, we will risk losing talented culinary professionals. They will work overseas and our culinary ranking will be very decreased. And as for restaurants, they may face closure due to the chronic understaffing, legal actions related to labor practices, or even damaged reputations. And last, for the Malaysia food tourism sector, an important part of the economy could also suffer. Many tourists will not like to go to our country anymore. What can we do to solve these problems? First of all, is mental health awareness training that were programs led by MMHA and NGOs like Befrienders can help staff recognize early signs of distress. The second one is improve work-life balance. The restaurants should explore shorter shifts or even rotating weekends off and the mandatory breaks. The third one is on-site or partner counseling. Larger hotels and F&B groups like Berjaya Groups are started to offer employee assistance program, which is EAPS. The fourth is cultural shifts, which means that you have to promote open conversations around mental health and create a better kitchen culture where support is normalized. The fifth one is leadership role modeling. Malaysian celebrity chefs such as Chef Wan have publicly supported mental wellness. This is because their leadership is powerful in shifting the mindset to the workers. 6 is policy support by the government. They must grant or tax incentive can be offered to the F&B establishment that implement the mental health programs. Lastly, company have to take good care of wages. They have to give the wages, bonus and OT deserved as long as they were good and independently powerful. According to the case study I've made, it's about Hilton. They launches Global Mental Wellbeing Initiative for team members. Hilton has expanded its Thrive at the Hilton platform with new global mental wellbeing resources aimed at supporting its 450,000 team members and destigmatizing mental health in the workplace. This year-long initiative, part of the Care for All program, offers flexible, accessible tools available in 9 languages and tailored for both corporate and franchise employees. What is included in there? First of all, it's on-demand tools, which is articles, videos, and even link in for the learning contents of the workers. And next is live webinars that covering topics like burnout, resilience, parenting, and important sleeps for the workers. And meanwhile, for the managers' toolkits is to help the leaders to support the team well-being and mental health. For the well-being partners, there are 3 Spring Health, Calm Sites, and even Better Up. And it will categorize into care for self, care for teams, and care for loved ones. Hilton continues to build its reputation as a purpose-driven employer and ranking as number 2 on Fortune's 2023 Best Companies to Work For list, yet they're achieving top rankings in over 30 countries globally. To summarize these cases, workplace stress is a growing concern in the Malaysian culinary industry. Everyone must be aware and take action about it. It has serious consequences for individual businesses and the country food cultures in Malaysia. However, changes is very possible through training, support systems, and cultural transformation, so that everyone must take care of each other's to neglect these things to be happen. As a conclusion, addressing this issue is very essential, not just for protecting workers, but preserving Malaysian culinary excellence in the worlds of their eyes. Supporting mental well-being ensures that chefs can thrive, innovate, and carry our food cultures forward into the future. And lastly, a mentally healthy kitchen is a productive and sustainable one. So that makes the forms that this problem is very important for us to take care of.